So there are maybe some patients who are in more rural communities or go to smaller cancer centers. You're at a very large center that has a lot of these resources. Do you think there is some benefit to patients if they have the ability to have a consult done by a specialist like yourself who only see or who sees mostly gastric cancer patients? Can they tap into that like as a one-time consult when they're diagnosed, particularly if they have metastatic disease? And could they also tap into the resources of a larger center?
That is a great question, Lisa. And yes, we do that. We as part of a large urban medical center here, we have a great relationship with our community oncologists and primary care doctors and other subspecialists, where we are often referred for a second opinion or a third opinion. Sometimes it's really, is this the best treatment that I have? Or it's simply a question of, are there clinical trials? Because we would like to refer to an urban medical center, a larger comprehensive cancer center for clinical trial options. And here, what I would like to add is that the post-pandemic period has really afforded, in my opinion, an easier way to do consultations. I know it's specific to certain institutions and certain centers, but I actually am okay with virtual medicine consultations for those who find it difficult to travel for an in-person visit. Again, I can't speak for all other cancer centers or oncologists, but we at least offer this ability to do that to help with that barrier of transportation. And when they are connected with us, sometimes if we are able to, we can even follow peripherally, almost like an extra care partner with the main local doctor who's driving more of the day-to-day, and we're kind of providing our recommendations as an extension from an urban medical center.
Great. Thank you for that information. I know as a cancer patient and a patient advocate, I will always recommend seeking out a consult from another person just to have another set of eyes on, particularly if it's a specialist like yourself who sees primarily that type of cancer. So thank you.
My activation tip for challenges faced with timely access to Asian and Hispanic subgroups and all racial groups, in my opinion, is to seek. It's always appropriate to seek second or third opinions, particularly at larger comprehensive cancer centers for the availability of clinical trials, or whether it's about questions about standard of care therapies, or actually just questions about, can we have a supportive service that you may offer that our local community providers may not offer? Or can you help us in a later stage of our treatment, not just a one-time kind of consultation, really just raising awareness that we do have ancillary staff that are very, very, very helpful in terms of addressing a lot of these healthcare access barriers. The one thing I would have liked to add was, I think involving church groups is a really, really great way for Asians and Hispanics, because they are so heavily invested in attending church services, and that's one of the innovative approaches from the Cedar-Sinai perspective, is that we actually have a disparity center, a center of community outreach, where we're actually engaging both Asians and Hispanics and other racial groups with their leaders in the churches, the local churches, to actually educate and promote awareness.